Welcome back. Well, as open enrollment for Medicare is well underway, some people may be asking themselves, do I have to make a change? Should I make a change? Or am I even eligible for Medicare?
Joining us with the answers are Chantal Yadav and Dan Peterson with CareMore. Thank you both so much for being with us.
Thank you. It's great to be here.
Well, I'm going to start super broad, Dan, and just kind of explain what Medicare even is.
Yeah, Medicare is a federal program for health insurance for people who are over 65 and for people that have a disability that qualify for Medicare. And people around the country are now in the open enrollment period. And every year that's from October 15th through December 7th. And that's the time when people can join a health plan, switch between plans. So it's a very important time of the year for recipients and their families as they look at what their options are out there.
So then you said to be eligible, you need to be 65 or older. So then how, Dan, are we even able to pick which plan is going to be the right plan for us?
It's very important, actually, to be a smart shopper. Information is power. I would tell members and patients to actually shop around, look for, what is covered in a health plan, look at the benefits, look at whether hospitalization is covered or not. And also, besides the common questions, I would suggest that you look at the clinical outcomes attached. Is there a care delivery model that is designed to support and meet your needs, your health needs?
So just like when you're purchasing anything or being a part of anything, you kind of have to do a self-assessment first.
Yes.
What do I need?
Yes.
And then kind of find the thing that's like a puzzle piece that fits my needs.
Absolutely.
And so does CareMore have maybe some unique programs that someone may see that that's the right puzzle piece?
Absolutely. CareMore has, CareMore is a unique organization in that we're a care delivery model as well as a provider group together. It's an organization that focuses on managing the frailest of the frail, and we have plans, programs designed to support those who are chronically ill. So we have various programs like diabetes management program, heart failure program, simple blood pressure monitoring, home monitoring, wireless programs, a lot of programs designed to support the need. Yeah.
Well, it sounds like CareMore is something that a lot of people in our community really probably need. So as far as getting to you, do you have locations that are throughout Pima County, or?
We do. We've been in Pima County now 6 years, and we have over 11,000 members on our plans here in Pima County. And we have 4 locations in town, spread out nicely across the geography. And people should check out our website or call our 1-800 number to learn more about CareMore. And I just want to echo what Dr. Yadav said about choices. So we have a great benefit design. People always go to the financial value first, but they should look at the clinical model and the health outcomes that follow the benefits. And that's what really sets CareMore apart.
Oh, go ahead.
Yeah, so our outcomes, when you look and compare with the national average, actually our rates of hospitalization are about 40% lower because it's a very team-based approach. It's a very evidence-based, high-touch model wherein, we have patient-centered medical homes, which are our care centers. Those are our neighborhood care centers wherein patients can come in and once they get in, they're evaluated. They undergo a 90-minute health assessment in the beginning, where we not only look at their medical needs but their behavioral, cognitive needs, and refer them into the appropriate programs and design an individualized care plan to support them. And our hospitalization, so we try to manage people out and keep them outside of the hospital, because we know, hospitals are not really safe places to be. You pick up germs and, a lot of things go on. And so hospitalization rates are a lot lower. We manage diabetes so well that our amputation rates are about 65% less than the national average in patients with diabetes who have wounds.
Wow. Now, of course, all this information we're going through, and even outside of this, I'm sure everyone's mailboxes are full of information. There's so much going on. Now, if somebody just kind of wants to simplify it and get some more information about CareMore, I'm sure you guys make it very simple and have someone available to kind of walk them through it.
Absolutely. We have member services that they can contact, and I would just, encourage you to come visit our care center. There's a wealth of information there.
And is this really the most important time that people should be coming to visit you during this enrollment period?
Yeah, this is the window during the year that they have a chance to look at their options and figure out what fits their needs financially and from a health perspective. So it's very important to pay attention on what choices are out there. And Dr. Yadav made a good suggestion. I would come check out the CareMore Care Center. We have some really great benefit consultants who can talk about the financial value and the clinical outcomes and what makes us unique. I would add, too, that we have a lot of great programs for people who are healthy and active as well. I know people that want to save money as a start, but it's great to have a medical model behind you. And we do fun things like dances and yoga and movie nights, and we have a fitness center attached to each of our clinics, so we get our members connected from a fitness perspective, and it's just a great approach to overall health.
Well, it sounds like a wonderful facility, and I'm so glad you both joined us this morning to give us some much-needed information in this enrollment period. Thank you both.
Thank you.
And for assistance with Medicare enrollment, call 1-844-730-0870. And to learn more about CareMore, visit caremore.com.